Hello everyone, this is Dr. Teymoorian, cataract and interventional glaucoma specialist here at Harvard Eye Associates, and we're going to continue our series on cataracts and cataract surgery. So in the prior video, we talked about what a cataract is and what the surgery is. Now let's turn over to probably one of the most important questions that we have about cataract surgery is what lens to put back in your eye. But let's take a step backwards here and figure out, why do I need a lens in the first place? Again, getting back to this analogy of your eye being like a camera, the lens of the camera of your eye is getting cloudier over time, so we're going to remove that out. That's the cataract. But we can't leave a camera empty without a lens, or else you won't have focusing power. So we do have a lens that we have to put back into the eye. Now, when we talk about your vision, one thing we do need to stress here is having 20/20 vision doesn't mean the same thing when you're looking far away, like when you're driving, versus when you're looking at your computer, or even when you're reading. That's actually three different types of vision, all of which we try to address as much as we can during surgery. Now, the best way to think about it here is, imagine you have a pair of binoculars on and you're looking over the horizon. Maybe you spot a beautiful bird. Once you're looking at it, you have to get it into focus, right? You have to make some subtle adjustments. But if you change your adjustment from looking at that bird that's far away to looking at a tree that's closer to you, you have to make some finer adjustments. And if you want to look at something even closer than that, maybe the end of your balcony, you have to make some further adjustments. What you're actually doing in the binoculars is changing the actual power that you're using the lens to see through. The eye generally does that when it's growing up and using it during life, but as you're getting a cataract, it has a harder time doing that. So when we take a new lens and we put it back into the eye, we have to understand that some of the lenses will have natural limitations in terms of what things we can cover and what things we can't. For instance, let's start off first with a standard or basic lens. This is the type of lens that's generally covered with cataract surgery. It's what we call a monofocal lens. Monofocal meaning one focal point. So back to this analogy of looking through the binoculars. We're looking at the bird, which is pretty far away, looking at the trees, which are relatively close, or trying to look at the end of your porch, which is very close. If we put in a single strength lens, a monofocal lens, we can only try to get really good vision at one of those three different distances because it only has one power. What most people do is they try to set their distance vision to be as clear as possible, but what that means is their up close vision, they're going to need some kind of corrective glasses. So the way I think about it here is, imagine you have your computer screen or dashboard right here. Everything beyond that is considered distance. Most people try to get that to be as clear as possible without glasses. Once you hit this computer range in, you have to wear some reading or computer glasses to correct it. That's going to come with your standard monofocal lens. Now, there are some people who have one other issue. It's called an astigmatism in the eye. People may hear that, but not quite sure what that means. What that means is, instead of the eye being perfectly round like a basketball, it's actually pointed up or pointed to the side or to any angle like a football. It's elongated in one direction. The problem when you have astigmatism is we want to make sure we get that addressed during surgery, because if we don't, trying to get even one of those three different types of vision will be very hard to do. Back to that analogy of the way the eye works. All the light rays are coming through the cornea, the clear window of your eye. They all have to land in one spot in the back of your eye. If the front surface of your eye, your cornea, isn't perfectly spherical, it's a little bit oval, it's going to distort the light longer in one axis versus in another. What that means is not all the light's going to land exactly where it needs to be. So even if we try to aim for good distance vision, but we don't address astigmatism if you have it in your eyes, even the distance vision will be blurry without corrective glasses. The good news is there's corrections for people with astigmatism. The amount of astigmatism correction and what options we have will depend on the patient and the level of degree of astigmatism they have. If they have a little bit of astigmatism, a couple of extra incisions placed on the cornea, the clear window of the eye, will get that addressed. However, if you have a moderate to severe amount of astigmatism, we're going to have to put a special lens in that'll help correct with that. The type of lens that works best with astigmatism is called a toric lens, T-O-R-I-C. What a toric lens does, much like your eye already being shaped like a football, it's, let's say, long this way, the toric lens adds power exactly 90 degrees away, so when you add in those 2 points, they cancel each other out. What that allows us to do is all the light then is able to land in one spot in the back part of your eye, getting that good clear vision. So for our patients that have astigmatism, if it's a little bit, we can address it with a couple of incisions. If it's more than a little bit, we have to use a special lens called a toric lens to help address that issue. Now, there's some people who say, even with the toric lens, we want to realize what exactly are we talking about when it comes to good vision. Again, the toric lens in itself is still a single strength lens, meaning if this is your computer dashboard, most people, everything beyond that will get it to be clear without glasses. But even with the toric lens, when you're looking at a dashboard you're still going to need some reading glasses at the store. Some people will ask, well, gosh, that's great to see a distance, but what if someone's texting me? I want to respond back to them, or if I quickly want to go to the store and I don't want to wear glasses, is there some other option that can get me to see not only far, but also see up close? There are a couple of options that are available for you. They're going to be called either multifocal lenses or extended depth of focus lenses. There are two different types of lenses. The thought process is the same. Each of these lenses offers different powers within the one lens we put back into your eye. So unlike the standard monofocal lens that comes with one power, these two lenses, the multifocal or extended depth of focus lens, offers multiple powers. The ability to see not just far away, but hopefully up close, and maybe some in the middle. Now, most people will ask me, that sounds great, why would anyone not pick that lens? Well, again, there's pluses and minuses to all the different lens options. The issue primarily with multifocal lens and with some extended depth of focus lenses is when people are driving at night, sometimes they can get a glare or halo effect on those oncoming headlights, making it hard to drive. Now, that might sound confusing because cataract symptoms can also have the same glare halo symptoms. And that's super important for us to figure out with our patients, especially with how important nighttime driving is for them. For instance, if a patient comes in and says, I'm having a hard time driving at night because of glare halos, we don't want to take out the cataract that's causing that and then put in a new lens that's actually going to give those symptoms right back. The benefits of these multifocal or extended depth of focus lenses is you get that wider range of focusing power. Again, trying to see distance and up close, hopefully some in the middle as well too. So there's pluses and minuses. And this is where it's truly important to take a step back, talk to your doctor, talk to the surgical counselor, really go over and understand what your needs are, what's important to you, so we can pick the best lens. For instance, people who don't generally go out at night but do a lot of reading, a multifocal lens would be a great option if their eye anatomy fits it. Other people, like a nighttime truck driver, we definitely can't have issues of glare or halos. Doing a multifocal would be less than ideal in that patient. Now, there's one other type of lens I want to bring up. It's called a light adjustable lens. This is a totally different type of lens that has a unique ability to actually change the power after we've done the surgery. So this lens actually gets inserted into the eye. We obviously put in the best power lens that we know about. And then afterwards, if we need to make some subtle changes to the power of the lens, we can actually use ultraviolet rays of light to change the effective power. Now, this treatment generally gets you to the prescription pretty set on. It just takes a lot more of a commitment from you and from our team here with subsequent follow-up visits to make sure we get that spot on, as it will require additional laser therapy multiple times afterwards, including a locking visit to really hone in that power over time. That lens in particular is good for people who've also had prior refractive surgery, where sometimes the best selection of the lens we have isn't necessarily as accurate as we want, and we'll be able to have a little bit of wiggle room to change the power of the lens. I know that sounds like a lot because there's a lot of different options in here. We talked all the way from a standard monofocal lens to toric lenses for astigmatism, to multifocal and extended depth of focus lenses to see far away and up close, and also light adjustable lenses that help us change the power of the lens even after surgery. Please take time to really process this information. But again, most importantly, as I've stressed before, the time to ask questions is always before surgery. Spend some time writing your questions down. We want to know about it because the more questions you ask, the better we understand what exactly is important to you, so we can tailor the lens selection to what you need. Thank you for your time, and we'll have one last video after this that'll give you just some additional options for cataract surgery. Appreciate it.